Morning, good morning. Good morning here. Can you hear me that? No, really? Let's see here, people. Uy, me gusta más bailar. Hola, hola. Hola. Hola, hola. Can you hear me? Something's wrong with the camera. I'm about to start to be online, to be streaming at 11 a.m. Hello, hello, testing. Okay, ACTC students, I know that you are in fall break. You're not at university now, the college right now. But some of you guys are taking this streaming online. Right?
Dude, I'll see if this actually be something funny. The things I have saying. You say you just keep watching all my sleep over and just laugh. So we go to that. Get all that. Just the younger. Yes.
Okay, somebody estudiantes. Okay, I want to see my Chromebooks here, guys. Plug them in here.
The other ones look like they have athletic bottoms on them. You know what I mean?
Oh, Braxton, you're going to the computer. Braxton. No. No, Connor. Braxton likes his computer. You just seen him put my. You're on my desk.
You say it's okay.
Okay. Connor did that. I put
No,
my.
it's okay.
Back, Connor.
Creo que estamos fast. No días.
Guys, 0 of us failed. Let's go. 0.
Okay, guys. Let's sit down, please. Get a Chromebook, guys. Get a Chromebook. Get a Chromebook, please.
0% fail? I mean, you realize. And I thought those were done, they charge you. I do free. Just, and I was like, okay, I'm gonna go for mine, but she's like, mine, what sucks is my sweater, like, please stop.
They move every day. I'm throwing down. Because if people like all three of them, because they like to move them.
I don't know why.
You did yesterday.
No, me too.
Oh.
Hey,
Hey, no.
guess what day it is? Spanish Day of America.
Oh, Hispanic honor something, whatever it's called. Hispanic Heritage Month. I know.
It's a great song.
Hold on.
No, nobody in this class failed. 0% fail rate?
Get a problem, guys, and so do good.
We did good.
Oh, like this. Hey, if you're sitting beside somebody, they go like, oh.
Never mind.
I hit you like this. I hit you like a snail. But no, it's the side.
You just charge.
These were great. Dude,
Bro, I went to yeah, for real. I went to one of these malls this morning. I got these pants, bro.
68.
The most comfortable pants I've ever put on. They're really hard.
I have a breakfast burrito waiting for me in the office. I'll be like.
We should tell Mr. Martinez he should give us some stamps to the class that didn't have a failure.
Change your sense more word, no movies, more WRS, no records. Yes, yes.
Okay, buenos días, estudiantes. Bienvenido a mi clase el día de hoy. Before I get started, today we start with this tutoring sessions. We're going to have English, math, ciencias, estudios sociales, y lengua extranjera or foreign language. Mr. Martin will be here from 3:30 to 4:30 on Tuesdays and Thursdays. Anyway, I'm here from Monday to Friday up to 6 p.m. so you can stay. If you want to fix any grade, you want to do something to remedy, to fix your grade, you can stay just a couple of minutes. Last year we did it, just stay 5-10 minutes and just do the activity and that's it. I'm really happy to see the results in the first term exam or test. Nobody failed. I just got 168 here. The rest of the grades were 90s and 90s and 100s. I'm really, really happy to see that what we have been doing here is really amazing. Congratulations, guys. I'm going to make some changes with the Spanish 2P2, Spanish 2P3. Even though the level is a little bit lower, I try to make activities less, I would say, harder, complicated than yours, guys. So I'm going to make a little change with those. Some strategy to implement. I would say E2A CCP7. One lady failed the test. She got a 50 because she took the test in 7 minutes. So it's impossible to take it in 7 minutes. I mean, the audio, the podcast is about 4 minutes 36 seconds, and she took it in 7 minutes. So that's why. Okay. And then she got a 50. All right. So I'm gonna talk to her today because I know with these Google Forms, I can know how much time you take the test. I mean, when you started and when you finish. So that's it. Okay, guys, what's going to happen today? We are now online. We are online here with the streaming. I'm going to go here straight to the class in Google Classroom. Everybody go to Google Classroom right now. Here we are. I'm going to get Google Classroom. In Google Classroom, guys, we got some activities to do today. Let me go to Español 2 ACC P4. Okay, you got here the streaming. In the streaming, we can see this I'll be back, you guys in ACTC and more students. I know that you have a full break, but I know that some people are getting into, I want to watch this video after that. Full break. Instrucciones, here we are, guys. Los deportes, la salud en el mundo hispano y el molcajete mexicano. What are you going to be doing today? You're going to be watching 3 videos, actually 3 videos here. It's 3 videos, edit. I'm going to go here. It's 3 videos, not 2. I want you to give me just a paragraph for each video. You're going to be watching 3 videos, write a 50-word English text. It doesn't have to be in Espanol. About each video because it's culture. Open a docs file in your computer and add it to the assignment. Title each paragraph. Give a title to each paragraph. It's going to be about La Salud, or it could be about deportes, or it could be about Mundo Hispano. El Molcajete Mexicano. Here you can see Hispanic Latino sports, most famous Hispanic athletes, leagues, competition, tournaments, Mexican cuisine, the Molcajete. My student last year already saw that video. I made a video last year here, and it was like a homecoming, Russell homecoming, or maybe Cardiff homecoming, and that restaurant was packed with a lot of homecoming students having lunch there, or maybe dinner there. So is that the thing? You can play with the video, you can forward it, you can rewind it, you can stop it, you can play with the video. I'm not going to present the video here in the screen because you need them. I mean, you need the time to do that. The first activity for today's quizzes. Take about 5 to 10 minutes, and then that's the word for today, guys. We have ACTC Sports, ACT Health. We're going to see the interview a lady who works or who studies at ACTC. She's going to be a nurse, or she's going to be a bacteriologist. She's working there. She's studying doing that. Okay, so those are the video, guys. I'm going to be online with these people here. Okay, that's it, guys. You have any question, please let me know. Congratulations for your excellent results in this class. Okay, tomorrow we have some activities to do, and that's it. Get into it. Okay, let me go now with people online. I would say that people online, as yesterday we had a meeting in the ACTC. The meeting was really a great meeting. I know that most of you guys are going to be in the fall break. The fall break is just from this week. You're coming back next week. But according to the officers yesterday, I mean the people, the staff in the meeting, some students are attending this streaming later. I would say you're going to open this recording. It's recorded. You can open and you can check. Okay. So having said that, we're going to go to the session number 4, sports and health. That is agenda, Hispanic and Latino sports, most famous Hispanic athletes, leagues, competitions, and tournaments, Mexican cuisine, molcajete. It's a video that I made 1 year ago in a restaurant here in Ashland, Kentucky. Maybe you know that. It's the same restaurant that gave us the food last year. In the activity, in the closure activity. Also, you're going to see somebody in your college. It's an interview with just a video that somebody did in ACTC. This lady talks about her experience having or taking classes at ACTC. She is in the medical field. So this topic is really related to the medical field because it is really important that nurses, doctors, bacteriologists, people that work in the medical field know how to treat Hispanos because Hispanos are a little bit different from Americans. One big difference between Hispanic people and American people is that we do believe, according to my research, we do believe 100% what the doctor says. Here, some people do not do that. That's what that's my research. My son came here about 1 year ago, and he was taking some seminars here. He's a doctor. He's an internal medicine doctor. And he noticed that. He told me that, people do not believe the doctors here. And even if the doctor is younger than the patient is going to say, oh, he's really young to be my doctor. He doesn't know anything. Anyway, so it's just part of the story today. Okay, there are some videos. The first video is this one, the Mexican cuisine. I'm going to play those videos sharing the screen because if I play from here, from YouTube, you cannot hear the audio. So for that reason, I'm going to play it, share the screen. Hispanic sports and athlete, this video has been restricted because copyright. I got some FIFA World Cup. I got some tournaments, international, the U.S. Open, some video that are restricted the YouTube. That's why I'm going to present it here directly from my computer. Finally, we're going to go and see the interview and the video from this lady. Here we got a quizzes about the Hispanic sports. You want to take it? That would be amazing. We are really excited that we're going to begin the classes coming week. We're going to go, especially with the medical field students at ACTC and Morehead students. Okay, so thank you for attending today this streaming, and let's get started with this. I'm going to show you around right now. The first thing is going to be the Hispanic and Latino sports. So I'm going to go here. Let me check if, okay. Little patient, I'm going to be with you in just a second. I'm going to go and look for the video that is in my desktop. Okay, it's about sports. It's right here. I'm sharing the screen right now. Please let me know if you can hear the video.
Regarding their eating habits and the practice of sports and exercise to be healthy. Also, the medical field students at ACTC will dissect the social, physiological, and physical treatments and approach when assisting the Hispanic community patients. Thank you for your participation in this activity. Till next time. La advocacia de los deportes en el mundo hispano sport improves social and cultural life because it brings people and communities to get closer and join their practices. Sports can help overcome differences and foster dialogue, thus helping to break down prejudices, stereotypes, cultural differences, ignorance, intolerance, and discrimination. The most practiced sports by Hispanic population are soccer, baseball, basketball, tennis, volleyball, cycling, bicycross, boxing, swimming, diving, athletics, rugby, motorsport, and skating. Of football or soccer. The most popular sport is soccer, and it is represented by the South American Soccer Confederation. The most important tournament at the national level is the Copa America, while at the club level it is the Copa Libertadores de America. The FIFA World Cup is the most important event in the world with more than 3.6 billion spectators.
Spanish are desperate to hear the final whistle. There it is! Spain are world champions! 2010. Desolation for the Dutch, but absolute ecstasy for the Spanish. Final score was Netherlands 0, Spain 1.
Okay, perfect. Like 7 people now. Well, it's good. Yeah, spring break. I mean, fall break.
Oh, baseball. Baseball began in Latin America and Cuba when they formed the Havana Baseball Club in 1868. But the game was prohibited by the Spanish rulers, and it was not until 1874 when the first documented game was recorded on the island, according to the newspaper The Artist.
MLB features players from all over the world, and Latinos are changing the game. How? Let's find out. This is Top 9. Number 1. The game's newest and most exciting faces are Latinos. You've heard us talk about Luis Robert, Juan Soto, Fernando Tatis Jr., etc., but that's because they're killing it right now. Robert has helped power the White Sox into October as a rookie. Soto has continued the hot start to his career, and Tatis, well, he's already looking to win MVP awards. Number 2. You can't miss who the Latinos are on a team. These guys play with unreal swagger, making difficult plays look like child's play. Their pasión is through the roof, never shying away from celebrating a big moment, and they simply just love to have fun. Number 3, let's talk Latin walk-up music. 21 different players are bumping Bad Bunny as they head to the plate this year, and a close second choice is El Alfa. But Latinos aren't the only ones jamming out. Joey Votto paid his respects to the late Selena, La Reina del Tex-Mex, by changing his walk-up song to Como la Flor during the Reds' visit to Monterrey for the Mexico series. Brian Dozier was responsible for making Pedro Capó's Calma the Nationals' 2019 World Series anthem, and Pedro took notice, even paying them a little good luck visit in DC. Number 4, do you remember this? What about this?
Ground ball, right side. Cabrera will cut it off. Galarraga covers. He's out. Oh, he's safe.
Both are legendary moments in baseball where Latinos changed the game forever. Armando Galarraga's almost perfect game in 2010 led to the eventual expansion of video review in MLB, and Jose Bautista's 2015 bat flip heard around the world paved the way for the new generation to play the game their way. Number 5. Speaking of leyendas, there are some no doubt future Latino Hall of Famers playing right now. Miguel Cabrera and Albert Pujols have had unreal careers and are breaking milestones left and right. And some other veteran Latinos like Yadier Molina and Robinson Cano could be well on their way to Cooperstown too. Time will tell. But these players' lasting legacies have set the bar for the future generation of Latino superstars. Number 6. Llegaron los Juniors. Vladimir Guerrero and Fernando Tatis are part of the new wave of second-generation players continuing their father's legacies. Just like his dad, Vladdy Jr. started his career with the Canadian team. He even wore his dad's old Expos jerseys during his first press conference. As for Tatis, the apple doesn't fall far from the tree. Fernando Sr. once hit 2 grand slams in the same inning, and Fernando Jr. is bringing that same energy to Grand Slam Diego. Number 7. 3 teams in the AL Central can nearly resemble World Baseball Classic squads on any given day. We're looking at you, Sox. Their usual lineup features up to 7 Latinos, and 4 of them are Cubanos. And not to be outshined, the Indians and Twins are both fueled by Dominican and Venezuelan talent. Number 8. Did someone say nachos? Latin-inspired dishes are taking over the concession stand. We're talking elote nuggets at Guaranteed Rate, churro dogs at Chase Field, Cuban sandwiches at Marlins Park, and of course, all kinds of tacos at just about every ballpark. Number 9. This opening day, 252 Latinos from 9 different countries made Major League rosters. The Dominican Republic led the way with 109 players, while Mauricio Dupont became the first player raised in Honduras to get the call. And in total, Latinos make up close to 30% of the league. So next time you're watching a game, keep an eye out for this passionate group of players who are helping to shape and inspire the sport we love.
Field tennis. It originated in Europe at the end of the 18th century and initially spread throughout the English-speaking countries, especially among the upper classes. Today, tennis has become globalized and practiced mainly in the West. Colombian tennis players Juan Sebastián Cabal and Robert Farah, who have attained 20 subtitles in a duo. And in 2021, these doubles tennis players won the U.S. Open and Wimbledon.
It's a grand slam double for Cabal and Farah. 2 sets to love, 6-4. First with 7 down. US Open. What a moment for these two. They'll remember this night as will all of Columbia. Looking a very tough result. They threw it for the number 1.
Cycling. Colombia has always been the country that has had the most cycling tradition with the best triumphs in Latin America. Colombian cyclists have won 3 most important competitions in the world: Tour of France, the Giro of Italy, and La Vuelta de España.
Let's finally, Viva Colombia! Viva Gandernal! Viva Tour de France! increíble.
Thanks for watching us and see you next time. Hasta pronto!
Okay, we're going to move now to see the video about food and Mexican food. Let me go and continue sharing the screen with you.
Tres Hermanos Núñez is absolutely my favorite place to eat in Kentucky. From the new decor to the best of everything on the menu. This is the best if you find an item on the menu that you want to try, but maybe a little something needs added for your taste, no problem. Just let the waiter or waitress know, and that's what you're gonna get. They have the best of everything. I've tried nearly everything on the menu, and I have not been disappointed with any selection. From TripAdvisor, Jay Whitaker. Mexican cuisine declared intangible heritage of humanity by UNESCO. Do you know anybody who doesn't know what enchiladas are, or someone who has never had tacos or any other type of Mexican food? In 2010, a Mexican official announced that the nation's cuisine has finally attained a status by UNESCO as an intangible cultural heritage of humanity. The official announcement came in early November 2010 in Nairobi, Kenya. But in short, the incredible variety of Mexican food is finally receiving its due. No other nation of food has been given this honor. Now, get this, France. France has been rejected twice. The last time France applied in 28, President Nicolas Sarkozy declared that we have the best gastronomy in the world, at least from our point of view. We want to be recognized as the world heritage. Mexican
Sí, señor.
cuisine is well known for its variety of flavors and colors, and for its combination of different spices and unique ingredients. Traditional Mexican food is based on corn, beans, and different types of chili peppers. Known for its varied flavors of spices, Mexican cuisine is the result of the Spanish conquistadores with the Aztec culture. Most of the Mexican food we eat today is a delicious combination of Asian traditions, Aztec, Mayan, and Spanish. The French also had their part in the story, adding baked goods such as sweetbreads and the bolillo, or commonly called French bread. Mexican gastronomy has significantly made an impact in the world. People from all parts of the globe have enjoyed the spicy, fresh, crispy, juicy, savory, crispy, and tender and delicious Mexican cuisine. Good afternoon, everybody. Today, the Diversity and Cultural Department of the Hispanic Community and Ecological College is celebrating the Hispanic Heritage Month from Tres Hermanos Núñez, located in Ashland, Kentucky. And with us, Mr. Thomas Sanchez, the manager, will lead our visit around the restaurant. Let's be part of this eye-opening experience to taste the real flavor of the Hispanic food and why it is declared intangible heritage by humanity by UNESCO. Welcome to the restaurant Tres Hermanos Núñez. Let's enjoy. Buenas tardes, Tomás. ¿Cómo está usted?
Muy bien, gracias. Bienvenidos al restaurante Tres Hermanos Núñez.
Bueno, vemos que su restaurante está muy apetecido el día de hoy. ¿Cuál es la razón por la cual las personas visitan su restaurante?
Bueno, como pueden ver, tenemos buena imagen, tenemos buena comida, todo lo que tenemos, lo que se cocina aquí, todo es fresco, ¿verdad? Ahora sí que pura mexicana, pues como un restaurante mexicano que es, pues pienso que por eso a la gente le gusta mucho venir para acá y tenemos buen servicio también.
Bueno, muchas gracias por la invitación. Nosotros vamos a probar el molcajete, el seafood para mi esposa y el molcajete mexicano para mí. A mí me gustaría que ustedes nos guiaran, nos orientaran, nos llevaran a la cocina y nos mostraran cómo preparar este delicioso plato.
Sí, cómo no. con mucho gusto los invito a la cocina.
Muchas gracias.
Sí.
Vamos.
Ahí vamos. Algo así, ¿verdad?
Buenas tardes, buenas tardes. Buenas tardes. Bueno, ¿qué tenemos para hoy?
Pues aquí como puede ver tenemos lo que son las lechuga, guacamole, tomate, pico de gallo, crema, queso rallado, salsa de enchilada, tenemos el chile, los frijoles, arroz, tenemos el pollo deshebrado, la carne molida.
Un mexicano y un seafood.
Salsa verde, queso fresco, ahí tienen frijolitos negros, pico de gallo, se mira muy delicioso, ¿verdad? Sí. Ahora sí están listos para salir.
nos sentamos a una mesa. Muchas gracias, compañero. Muchas gracias, muchas gracias. Y vamos a disfrutar. Se sirve unas ollas de barro muy calientes, como se puede apreciar en el video anterior. Bueno. Mucha gente llama la olla. Que this was called molcajete. El sabor, la textura, crispy, ingredientes. Delicioso, delicioso.
Coménteme qué le pareció la comida.
Exquisita, muy rica, muchas gracias, Tomás, delicioso, ese molcajete estuvo delicioso, como se da cuenta, lo disfrutamos, nos lo comemos todos, los ingredientes, la frescura, realmente el sabor estuvo espectacular. La comida mexicana es supremamente exquisita, muchas gracias.
Me da mucho gusto que le haya gustado y esperemos verlo otra vez por acá.
Claro que sí, sí señor, muchas gracias.
Muchas gracias.
Tomás, muchísimas gracias por su atención el día de hoy en su restaurante. Excelente la comida, lo disfrutamos muchísimo. Muchas, muchas gracias.
Esperamos verlo por aquí pronto y me dio mucho gusto que vinieron a nuestro restaurante. Más que nada, muchas gracias.
¿Ustedes tienen promociones aquí en la
Tenemos esta semana, tenemos las Happy Tuesday, tenemos toda la semana de especiales. Tenemos margaritas especial.
interesante?
Todo muy gratuito.
Totalmente de acuerdo. Muchísimas gracias. Entonces, deseamos muchísima suerte en su restaurante y aquí estaremos, creo que sí. Esperamos que toda la comunidad de Hispanic Community College tenga la oportunidad de visitar el restaurante Tres Hermanos Núñez aquí en SmrtzT&T. El servicio es espectacular, la comida es súper deliciosa, la atención, el servicio es súpermente rápido, los meseros lo atendieron muy rápido y el sabor, la textura de la comida fue exquisito. Realmente es un lugar en el cual usted va a disfrutar muchísimo de la comida hispana, comida mexicana. Hay que recordar que la comida mexicana es considerada patrimonio intangible de la humanidad por la UNESCO, por ser la mejor comida del mundo, inclusive mejor que la comida francesa. Y tenemos ese honor y tenemos el placer de disfrutar la comida aquí con Tres Hermanos Núñez. Muchas gracias.
Sí, aprovechando la oportunidad, nos gustaría invitar a toda nuestra gente que visite, aquí estamos, pensando en la comida.
Bueno, muchas gracias, Tomás. Nos feliz tarde, feliz tarde. Que estén bien.
Muchas gracias.
Bueno. Okay, guys, what about you? Have you ever tried Hispanic food, Mexican food? Well, that was a wonderful experience. And this year we're gonna have the same. We're going to enjoy Mexican cuisine in our classroom ceremony coming. Okay, what about if we go now to the last video for today, which is about health at ACTC. It is now 11:50. We got about 10 more minutes. I would say this video is gonna take that time. So don't forget, we're gonna be working on coming week on these videos in class. So I hope you can download them or at least see them. Let's go with the next video.
Hi, I'm Cindy Fritz. I am an ACTC student here. I found a lot out about ACTC whenever I went to go get my GED. I met a young lady, Krisha Spears, and she encouraged me to come out and apply for ACTC. So after I got my GED, I was able to do so. This is my second semester in the LPN program. We have a bunch of wonderful instructors here. Everybody at ACTC wants to see you succeed. I am a non-traditional student. I was out of school 30 years before I decided to come back to school. And this is definitely the place to come.
I'd like to welcome everybody to today's presentation on enhancing mental and physical health for Hispanic and Latino community. I'm your host and cultural broker, Abby Leeper from Paul G. Blazer High School. Hi, Abby. I'm your host and cultural broker, Jocelyn Bryant from Paul G. Blazer High School. And today we will also talk about the most played sports and the Mundo Latino and their most prominent athletes. So let's get started. In this session, we will cover a lot of ground. We're going to review the ecological framework and apply it to the culturally responsive counseling. We will learn about nuances in communication with people who are Hispanic or Latino. We will review cultural beliefs which may impact treatment or help for illness. We will also briefly explore some cultural balance syndromes, identify psychosocial risks and protective factors to target the Hispanic and Latino population. As a multicultural and multilingual broker, I always start off my presentations by saying that this is a broad overgeneralized knowledge that may adhere to or embrace the Hispanic community in general terms. Some principles may change, but the most important aspect is that these generalizations can guide you in questions to ask and things to be aware of when you are working with this community. The ecological system framework provides a structure for understanding the importance of cultural adaptation in social work and counseling practice, especially from the people who work in the healthcare system, such as doctors, therapists, and nurses. On the macro level of this framework, we are talking about how cultural frames norms, values, and behaviors that operate on every other level. It is important for people who work in the medical field to explore social media, television, and literature about the Hispanic population. The micro level represents the individual beliefs and behaviors, and that's where it is important to differentiate with your Hispanic or Latino patient how much traditional Hispanic or American culture they embrace. The meso level represents family customs, traditions, and communication patterns. And finally, the exo level is how the individual perceives and interacts with larger structures such as school, work sites, society, and local communities. All of these levels can guide the medical field professions to determine the effective social and professional approaches to assist the patient from the Hispanic community. It is important to recognize that the individual influences those in the immediate area of interaction. Communication. Among Hispanics, they share a series of verbal and nonverbal cues that denote respect, recognition, and trustworthiness. Hispanic population emphasizes that the first moment of interaction with people determines a good rapport or effective communication of their needs, opinions, or ideas. Especially with older people, the formality and respect of the communication is fundamental to establish a base of good dialogue. We strongly recommend that people who work in the medical field address older people with their last name. Eye contact is appropriate in certain cases, but staring is considered impolite and intimidating. It's important to remember that as a clinician, you are in this interesting paradigm where you may be younger than the patient. However, you have a position of authority for your knowledge and professionalism. In most of the cases, Hispanic patients show some deference and respect to you because it's your position. It's uncommon for Hispanic people to be aggressive or assertive in healthcare interactions. They usually respond in silence or non-compliance, just like other cultures, such as Asians. When assisting or having healthcare interactions with Hispanics, try to use open-ended questions, not yes or no questions, as it is common within the American culture. Hispanics believe in a fruitful and rich conversation with their doctors and medical field personnel. This pattern of communication allows a better understanding of the benefits and drawbacks of treatment, and it also motivates the patient to follow clinicians' counsels. When working with the Hispanic population, we must build rapport with them. It's important to start saying hi, these are my credentials, sit down and start asking yes-no questions. You have to invite someone in you. You need to help them and get comfortable, and you also have to make limited eye contact. Ask them how their day is going and some other pleasantries. Try to build a polite and courteous rapport with recognition and appreciation. You, as the physician, need to communicate trustworthiness as well as understand that desire to be in their shoes and help them in their treatment. Hispanics expect healthcare professionals to be warm and personnel and express a strong need to be treated with dignity. If Spanish is their primary language, it's highly recommended to try to make an effort to communicate with them in Spanish to some degree. This does not mean you have to hold the whole session in Spanish if you're not bilingual. When somebody speaks their language, the message does not go to their mind. The message goes to their heart. It's advisable to try to avoid gesturing too much because many gestures may have adverse connotations. It's important to be aware of what types of gestures may be considered offensive. Hispanics and Latinos are not a race. Hispanos and Latinos are an ethnicity rather than a race. In the United States, we find 5 larger groups: Mexicans, Puerto Ricans, Cubans, Central Americans, and South Americans. Each of these cultural groups have their own unique beliefs, practices, and perspectives. Healthcare professionals should not assume that anyone who is Hispanic fits into this little mold, just like anybody who is an American. It's vital to respect that every culture has its own country pride, and in their history, we need to recognize their origins and cultural background. 90% of Hispanics place great importance in the practice of Roman Catholicism. Central tenets of Catholicism are sacrifice, charity, and forgiveness. We need to remember this when we are working with them in terms of mental health. Probably they are also sharing with their priest their mental or physical health, which may hinder the boldness of the treatment. But this could also be a great source of strength and recovery sacrifice. Hispanic Catholic beliefs may include candles with pictures of saints, but with the new advent of religions and Protestant churches, it's important to not think that all Hispanics are Catholics. You might want to ask them because some religions do not accept certain scientific practices. The Jehovah's Witnesses do not accept blood transfusions, so the healthcare professionals must be aware of this in case they need to proceed with the treatment. At this moment, we have some people that uphold their religious beliefs to avoid COVID vaccinations.
La Familia in the Hispanic community provides a sense of strength, security, and structure, and it actually enhances mental health. La Familia is the collective identity that serves as a buffer against external stresses in the environment because they know they got each other, they rely on each other, and they've got emotional as well as practical support. So it is important that the Hispanic patient attends the doctor's appointments with their immediate family member. Do not feel surprised if one of your patients come to your session with one or more family members. Doctor's visit. American healthcare providers are dealing with patients from different cultures and latitudes. They should ask their Hispanic patients what causes the health problems and what needs to be done to remedy them. Health professionals need to be aware that some Hispanics are less likely to use medical alternatives and prefer to use home remedies. There are some reasons Hispanics do not visit the doctor, such as legal documentation, which is the immigration status, lack of health care plan, expensive and recurrent bills, financial constraints, and not available Spanish-speaking service providers, feeling of unwelcoming in the clinics, and discrimination, prejudice, and racial bias. Alcohol and drug abuse. For Hispanics, drinking alcohol is often a part of social occasions and celebrations, and solitary drinking is discouraged. Hispanics believe that those who abuse substances or alcohol cause their whole family to suffer. Paradoxically, driving under the influence of alcohol is one of the most serious problems in the Hispanic population. Cultural brown syndromes. Local ways of explaining any of a wide assortment of misfortunes. Hispanic populations suffer from nerviosismo. Nerviosismo is a sickness of the nerves, and it is commonly treated medically or spiritually. Susto is fright resulting in soul loss and may be acute or chronic and includes a variety of vague complaints. Susto is more common in women than in men. Yerbatero or herbalist is someone who may have some remedies to help them cope with whatever psychological or physiological symptoms. Sobandero is a massage therapist who provides massages with cream for joint relief.
Partera is the midwife who helps women have children and take care of them. Curandero is someone who heals physical and spiritual invalids. Common Hispanic health issues. For Hispanics, the top 5 are cancer, heart disease, unintentional injuries, stroke, and diabetes. The CDC looked at subgroups within the Latino community and found that different groups have a variety of degrees in health risk. Caring for yourself. Because of genetics and environment, each unique ethnic group in all the United States had an increased risk for developing certain conditions. It's important to recognize your risks so you can seek proper diagnosis and treatment. Several health issues are more prevalent in the Hispanic people than in the general population. Obesity. Hispanic Americans are 1.2 times as likely to be obese than non-Hispanic whites. This is especially important because obesity can lead to other health challenges. Diabetes. About 40% of adults in the United States are expected to develop type 2 diabetes in their lifetime. However, more than 50% of Hispanics are expected to someday be diagnosed with it. Hypertension, also known as high blood pressure. Nearly 1 in 4 Hispanics have high blood pressure, which can be a precursor to a heart attack, stroke, kidney disease, or heart failure. Chronic kidney disease. Hispanics are 1.5 more likely to have kidney failure compared to other Americans. In fact, 20% of people on the kidney transplant waiting list are Hispanics. Chronic liver disease. Hispanics are at a higher risk for developing certain liver diseases. Although the exact cause is unknown, it can be a result of conditions such as chronic alcoholism, obesity, and exposure to hepatitis B and C viruses. Cancer. Overall, cancer rates among Hispanics are generally lower. However, those who were born outside of the U.S. are at a higher risk for specific cancers related to such as infections of the stomach, liver, or cervical cancer. To wrap up this chapter, it is important that the healthcare provider motivates the Hispanic patients, provides trustworthy feedback and support. It is also recommended to learn about each family member and their cultural background, history of the relative's illness, coping strategies, goals and expectations of treatment. Thanks for watching us. Hasta pronto!
Oh, guys, this is really informative video because it's really important to know how to treat Hispanic people. Maybe they're going to be your client or patients. I have experience with Dr. Canty, who is a gastroenterologist in Kingston Medical Center, and Mr. Juan Bastidas. He's a Colombian doctor, surgeon. He's a cardiothoracic surgeon and gastroenterologist at Kingston Medical Center. He's from Colombia. He came to the United States about 20 years ago. And he studied Lexington University. He got his master's and specialization here in gastroenterology. And he's working now for this hospital. And it's really interesting to see how he has learned from the American culture, and American culture are learning from American people are learning from the Colombian doctor. Well, this is the end of the streaming for today. I hope you can feel enlightened with these 3 videos. We talk about different things, and yeah, there is something here. There's yerbatero, curandero, and those are some kind of words and expressions that we use in the Hispanic world. Sometimes we believe in herbs, we believe in plants, and because the jungle, because the Amazon forest. We sometimes we believe in those medicine, not white medicine, but maybe this kind of holistic medicine. Okay, so enjoy the rest of the fall break, and I'll see you coming Monday. Have a wonderful day. See you. Do not forget, we're gonna have the closure of this Hispanic Heritage Month celebration on October 31st. It's gonna be on Monday. It's gonna be from 11 to 1. So you're invited to be part of this celebration. We covered lunch for you, and a lot of activities are going to be taking place there. Have a wonderful weekend and continue enjoying your fall break. Bye bye. See you. Okay, guys, I'm done with this streaming. Thank you very much for your patience and everything, ladies and gentlemen. Okay, it was really good to see this. I'm going to go and end this broadcast. And right now,